Hi, everybody. Dr. Marissa Tenenbaum here from West County Plastic Surgeons of Washington University. Let's see, I'm again trying to be live on Facebook and Instagram. And as you all know, I'm challenged technically. But I think I am now live on both. So many people already joining. Hi, everybody. So today I wanted to talk about neck lift in particular, but I will preface that by saying talking about something like neck lift um, in an isolated fashion is a little bit misleading because when we evaluate the face and neck as plastic surgeons, we're really looking at the entire face and neck because our goal is not only to help with some anti-aging, but also to keep the neck and face in good harmony. So somebody may come in complaining about their neck, but we're going to really look at everything, and it is super important. Oh my gosh, hi Amy. It is super important to address your concerns, and clearly, if somebody is coming in talking about their neck, then that is what bothers them the most, and so we will focus there. But I'm also going to take a look at other areas of the face and maybe make some suggestions or kind of ask about that. So, what do we think about with the neck? Neck has a lot of layers: skin, fat, muscle. There are some glands in the neck as well. Fat can be in front of and behind this muscle here. So we will be evaluating all of that. We'll be evaluating kind of the texture and quality of the skin, how much fat, where the fat is located, the quality of the muscle, if any of the glands are drooping. And then, as I mentioned, kind of the neck leads into sort of that lower face and especially the jawline. So I would say that in my experience and my practice, it's really uncommon for me to address the neck in complete isolation, especially as it pertains to the jawline, jowling, kind of that lower face. So it's much more common for me to do a neck lift in conjunction with a lower facelift than it is to do a complete isolated neck lift on its own. So I just want to kind of throw that out there ahead of time. So when we think about neck lifting, neck rejuvenation, we are evaluating all those structures. So we can think about things like liposuction to decrease fat, and then the surgical lifting to reposition tissue, muscle, fat, and skin. Typically, whenever we're repositioning tissue, it is going to require some scars. The scars for a neck lift sometimes can be just behind the ear only, kind of in that sulcus of the ear, or it can also be in front of the ear, similar to a facelift, and behind the ear. When we need to lift higher areas in the face, then that scar sometimes can come up along the hairline. But all of these scars, we can camouflage them pretty well. So in front of the ear, kind of behind the pointer, and around the lobe, we have techniques, and the way we do things, often that scar, especially over time, is barely noticeable. If it's behind the ear, I personally like to do my very best to keep it only in the sulcus of the ear and not cross over towards the hair if we can help it, because again, that's going to be more hidden for hairstyles, short hairstyles, or ponytails. So that's really, really important, I think. Sometimes some scars below the chin here, again, those can be hidden very, very well. Typically in my practice, this is going to be something that's done with you asleep. So you're not going to be awake chatting with me, although I have done that. I prefer for you to be asleep. I think it's more comfortable for both of us. However, you can generally go home the same day. Depending on what I'm doing, you may or may not have some drain tubes. If you do have a drain tube, then often that can come out in a day or two. It doesn't need to stay in very long. And again, the way that I do my technique, often a drain tube is not necessary at all. Typically, I like a big bulky dressing, and so you will go home with a big bulky dressing, and then we start transitioning you over into just kind of a looser, like a chin strap, and some things to take care of the incisions. Taking care of the incisions and managing any bruising and swelling is very similar to other surgeries that we do with different ointments over the incision lines. Those stitches generally will come out the following week in the office, and then we again kind of continue to help you manage that incision line to get the best possible scar. Downtime, it's going to be a couple weeks where I don't really want you to exercise or do anything very strenuous. So that means you can be up and walking around the house, but nothing vigorous, no real exercise. Being real careful to keep your head elevated as much as possible. So sleeping on some pillows, um, keeping your head elevated as much as possible. Usually people can go out and kind of be a little bit social after that first week. After these stitches come out, a lot of the bruising and swelling will be gone. You'll still have some, but especially if you have hair that can kind of cover that area, usually you can camouflage that pretty well. Especially nowadays when many of us are wearing masks and things like that, it gets even easier. Another common thing we do with these procedures would be fat injections to the face. That can make you a bit more swollen. So in terms of kind of how quickly you can be back out in public, that may increase that time because you may have a little bit more puffiness or swelling, especially if we fat graft around the eyes. Again, I mentioned we're talking about neck lift today, but we want to rejuvenate everything. And so sometimes we are adding some ancillary things on, like fat transfer, super common to do during any facial procedure, but especially lower face and neck lifting. And then especially if we're addressing the eyes, which obviously you guys know we talk about eyes in another topic, so I'm not going to spend too much time on that. But that can increase kind of your social downtime, if you will, if we're adding on some of those procedures. Some of the other questions I got, of course, I'm a surgeon and we're talking about surgery, but people always want to know about non-surgical options for rejuvenation of the neck and lower face. And there are some options that can be great depending on your anatomy and what you're hoping to accomplish. So in general, whether we're talking about the face, the eyes, the body, surgical options are generally going to be a bit more dramatic improvement over non-surgical options. However, sometimes they can really complement each other and they don't always do the same thing. So it's not uncommon that I'm going to recommend, even if we are recommending surgery, non-surgical treatments to help complement your results. So some of the things that are really common for that would be skin treatments. So surgery will help kind of reposition loose or droopy skin. It can help debulk fat, reposition loose or drooping muscles, but it doesn't really affect the actual quality of the skin. So that means some of the finer lines or thinner texture of, or rougher texture of the skin, thinness of the skin, color changes or pigment changes such as sun damage. All of those things really aren't going to be addressed with surgery. We're going to need non-surgical options to treat those. Things like laser resurfacing, IPL, different peels, different treatments like that. Sometimes we do that at the same time as surgery. Sometimes I like to wait and do it a bit later. So a common thing that I like to do after facelift or neck lift procedures or even eye procedures is a week later, when stitches are ready to come out, do a laser resurfacing of the skin, because the laser resurfacing is great for the skin, tightens the skin, helps with pigment, helps with fine lines, helps with did I already say pigment issues and fine lines? I think I did. But it also, we can treat scars, and sometimes treating early scars with things like laser resurfacing or even microneedling can really help that scar look as good as possible. So because of that, sometimes I actually like to wait to do the treatment until sutures come out and we can also treat the scar. But that can be done even without surgery. So things that can be done without surgery, again, laser resurfacing can help with some minimal tightening. Again, not a replacement for surgery, but minimal tightening in the neck, in the jawline, kind of this jowl area. If it's very minimal, you're going to see some subtle improvements there. Microneedling also, especially if we add radio frequency to it or we add PRP to it, that can really help. Fillers and Botox. So fillers and Botox are great all the time. So I mentioned it's very common to inject fat in the face. That is going to help with loss of volume, sinking, sagging. So we can do fat at the time of surgery to help that. But over time, sometimes to maintain that result or augment that result, doing fillers can really help. So fillers kind of to the cheek line, to the jaw line, to kind of help crisp up the angle of the jaw and make a nice, more smooth jawline, a fuller cheek, all of those things that can be done in conjunction. Um, or instead of surgery, again, if it's a mild issue. Thread lifting. So this is going to be a whole different topic. So I'm not going to spend a ton of time on it, but thread lifting, if somebody has a really minor, mild, kind of drooping, sagging, thread lifting can help kind of elevate some of that tissue, which again can help along the jawline and the neck. Thread lifting for the neck itself is done. I don't love it for the neck. When people's necks really start to sag, I'm much more likely to recommend surgery again, unless it's really mild. One of the best things for mild neck sagging would be an ultherapy treatment, which we've talked about that before in some of these videos. It's an ultrasound-based technology that helps stimulate some of the deeper collagen. We can use it on the décolleté, the neck, the jawline, the cheeks, around the eyes to treat the under eyes, as well as little brow lifts. It does work. We do it in the office. It does not require anesthesia. However, it can be somewhat painful. And so we do usually give some adjunct to help with pain. Microneedling with PRP, mildly tighten up neck skin. Yes, so absolutely. The whole face and neck, it absolutely can. I love adding PRP, whether it's an injection or the microneedling with the topical PRP. I think it's good to combine those. So injections of PRP can be great, and then using that topically with the microneedling. Again, not necessarily a replacement for surgical facelifting or surgical neck lifting, but absolutely can really help, especially series of treatments over time. And then on top of that, it can really accentuate a surgical result. So just because somebody has had a neck lift and a facelift, you know, the bad news is it means, you know, some people think, oh, if I just do surgery, then I'll never have to come to your office ever again. Well, yeah, maybe, but certainly we can continue to enhance results with these non-surgical treatments, as well as treat some different things, like I mentioned before, the skin texture, the pigment issues, or things that really surgery is not going to address. I think I answered all the questions that came in ahead of time. I'm trying to just think. Oh, one thing, again, you guys know that I harp a lot on skincare, just skincare in general. Really good skincare before surgery and after surgery is also going to really, really enhance your results. So bottom line for necks, get evaluated by a plastic surgeon like myself, or another great plastic surgeon. I see my Miss Whitney is on here. She works for Mike Nyack, who he is amazing and does amazing necks. So be evaluated, get our opinion. Get the opinion of somebody who is experienced in surgical as well as non-surgical treatments, so that they can help you make a good decision about what's best for you at that time, and then also some of the non-surgical things to help extend the life of that result. Don't be closed off to just the neck, for example. You want to let us really kind of help everything blend and harmonize. So at least kind of looking at the lower face, jawline, mid face. Maybe you save the upper face, eyes and brows for another time, another day. That's completely fine. But sometimes there are things we can do just to help everything look more harmonious. I think that's really important for a nice, natural, not surgical looking result. Okay, so I think I answered all the questions that came in ahead of time. If not, message me and I will answer. And again, thank you so much for tuning in. And can't wait to see you guys with the next video. Okay.